Good morning. It's a real pleasure to be asked to come and give you my Moynihan Travelling Fellow report from 2011. It's now just over a year since I undertook the fellowship, and having carried out my first year as a consultant at Glasgow Royal Infirmary, it all feels like a very long time ago now. Just to give you a little background, I was a surgical registrar in Glasgow on the West of Scotland Higher Surgical Training Scheme. And during that time, I undertook an MD degree in the area of perioperative care and enhanced recovery. And like a lot of Glasgow trainees, we don't like to leave the city much. And so other than a short visit to St Mark's Hospital, most of my training has been carried out in Glasgow. I followed a subspecialty interest in colorectal surgery and undertook one of the Ethicon laparoscopic fellowships. And you can imagine my delight when I was placed in Glasgow for that. And realising the inevitability of my situation, I decided to apply for a consultant post at Glasgow Royal Infirmary, which I started in February of last year. So before starting that, I decided I needed to try and broaden my horizons a little. And to that aim, I set off to London to the interviews for the Moynihan Travelling Fellowship. And I'm very grateful and honoured that the association selected me for this. The fellowship that I undertook was firstly to visit the Leahy Clinic in Boston and a surgeon there called Rocco Ricciardi. I'd collaborated with Rocco through email on a number of research publications, and I thought this would be a perfect opportunity to meet up and also to find out a little bit about the management of colorectal patients at the Leahy Clinic. Secondly, I also wanted to visit the Cleveland Clinic, which I'm sure is a hospital that's well known to many of you. The mentor from my laparoscopic fellowship, Richard Malloy, was a fellow at the Cleveland Clinic in the 90s at the same time as Dr. Feza Remzi, who's now the chair of colorectal surgery at Cleveland, and he very kindly invited me to come to Cleveland for a visit. The aims and objectives of my fellowship, I hope, are very much in keeping with the foundations of the association, which are for the advancement of the science and art of surgery and the promotion of friendship amongst surgeons. So, with respect to the art of surgery, I wanted to find out about the approach to minimally invasive surgery in these two centres who have a wealth of experience. In particular, the Cleveland Clinic were one of the first to report total colectomy through a single incision route, something I didn't have much experience of. I was also wanting to develop transanal endoscopic microsurgery as part of my practice at Glasgow Royal, and I wanted to pick up any technical innovations that I could integrate into my own practice on returning from the fellowship. Secondly, I wanted to find out about their management of pouch patients. IBD makes up a large part of my practice at Glasgow Royal, and the Cleveland Clinic has a huge database of over 4,000 pouch patients, and so I thought I could certainly learn something from their experience. I was invited to give a couple of presentations at grand rounds in both hospitals, and so presented there firstly some of my work on enhanced recovery after surgery, and also a new technique that we developed for laparoscopic mobilization of the left colon, which we'd done some work on in Glasgow. I also wanted to develop some friendships and professional links for the future, and just to take some time out of a busy clinical job to think about how I wanted to run my own independent practice after starting. So when I first spoke to Rocco about visiting Boston in January, he seemed a little puzzled about the timing, and when I got there I realised why. I arrived in the middle of the worst snowstorm in Boston for the last 20 years. It was minus 25 when I arrived, and there was about 15 inches of snowfall each day. Despite that, nothing stopped. The roads were clear, and everything just carried on as normal. So this is the Leahy Clinic. It was founded in 1923 by Frank Leahy, along with an anaesthetist and a gastroenterologist. And at that time, a group practice was fairly uncommon, and it grew very quickly to become one of the top centres in the US. It's a not-for-profit teaching hospital. That's not to say that some of the surgeons aren't making a healthy profit. And it's very much a surgical centre. It has 25 operating theatres, and the other physicians and other specialties that are there are all really there to serve the surgeons, which leads for some interesting professional relationships. It's also affiliated with Harvard and Tufts University Medical Schools in Boston. This is the team at the Leahy. I have to say that I had a really great few weeks there. They were incredibly welcoming and generous. I don't think I spent a single evening in my hotel room as they took me out for dinner or took me to meet their families, and it's really a time that I won't forget. The only surgeon that's not seen there is Peter Marcello, and that's because he never stands still long enough that you can get a picture of him. The working day was a little shock to the system. Rocco would pick me up at my hotel at 5:30. The fellows by that point had already done a pre-ward round, and then we went on the ward round at 6 a.m, and theatres would start at 7 a.m, and that would then carry on throughout the day. And I also had some experience of endoscopy and clinics during my time there. The only morning that was different was a Wednesday morning, which was their teaching morning. And again, after rounds, they then spent an hour going over all the research projects in the unit, and that went on a weekly basis. Following that, we had the grand rounds, which is really the hospital meeting, attended by about 100 to 150 of the surgeons in the hospital. Then it was back to the colorectal unit for an hour and a half of teaching led by the consultants, where they grilled the trainees on various aspects of colorectal surgery, and that was followed then by the MDT. So it was really 4 hours every week of very dedicated teaching, and this was certainly something that I've tried to replicate coming back to my own unit at Glasgow Royal. We now set aside a Monday morning to do teaching and to have our MDT, and it works fairly well. The case mix at the Leahy Clinic was very similar, I would say, to a UK centre. They had a good variety of things while I was there. They did a lot of hand-assisted laparoscopic surgery, which was something that I didn't have much experience of before, and I think it did change some of my preconceptions of hand-assisted laparoscopic surgery. It was led very much by Peter Marcello, who's got a huge experience of both straight lap and hand-assisted, but finds the hand-assisted to be a bit more versatile, particularly in obese patients. And certainly the hand was very much used just as a retractor and not at all as a dissector. Rocco himself has a tertiary referral practice for AIN surveillance and the management of anal cancer, which was interesting to see. And had a lot of time to talk about research. They're in a very enviable position of having lots of funding and great links through Harvard University. I also, Tom Reed, who's one of the surgeons there, is one of the editors of Diseases of Colon and Rectum. So since I've come back from Boston, I'm now inundated with articles to review for DCR. And I think the other thing that I picked up in Boston was just the focus that they place on communication, both with their patients and with the family doctors. And I really found that was first class, and tried to pick up from some of the things that I learned through that. Just in case you thought that I didn't see anything other than the inside of the hospital, I did manage to see a little of Boston. This is Rocco and his wife and daughter, who were very kind to me during my time there and took me out to see the sights in Boston. Being an Italian, this was the most important place in Boston, according to Rocco. This is Mike's Pastry in Little Italy, a favourite haunt of the American president when he's in town. And after all those cakes, it was important to find something to wash it down with. I'm not sure if it was because I was the Moynihan Fellow, but I managed to find a pub where everyone knew my name. And I'm very grateful to the association for giving me the sponsorship so that I could manage this trip. And I also saw a little bit of history while I was there. The Freedom Trail, as some of you will know, takes you around the historic sites related to American independence. So then I moved on to Cleveland, or as some people call Cleveland, the Mistake by the Lake. There won't be any pictures of Cleveland during the presentation because it's not the most attractive of cities, and really the main thing that's there is the clinic itself. This is the original clinic building from 1921, and it's grown from these beginnings into one of the largest private medical centres in the world. They have 4 or 5 hotels attached to the hospital for patients flying in from all over the globe. This is their new heart centre, built recently at the cost of $500 million, which is the largest single-use hospital facility in the world. And this is the Cryle building, named after George Cryle, the gentleman in the top left, one of the founders of the Cleveland Clinic. And this is the home to the colorectal department where I spent most of my time. And by a nice coincidence, this is a picture of George Cryle with Lord Barclay Moynihan, who gave his name to the fellowship. This picture was taken in France during the First World War, and it was following his return from the First World War that Cryle helped to set up the Cleveland Clinic. This is Feza Remzi, who looked after me during my time in Cleveland. And in the background, some of you will recognise Dr. Victor Fazio, who I had a real pleasure of spending some time with. He took me for 2 or 3 hours in his office, imparting his wisdom and telling me a little bit about his experience and giving me some advice. And that was a real highlight of my trip to Cleveland. My experience there was a little different to that in Boston. They have, partly due to the scale of the place, it's enormous, and also a little to do with the referral practice to Cleveland, so it was certainly a little different to Boston. I managed to see a lot of pouch surgery while I was there. They do 200 pouches and 50 redo pouches every year, and there was a number of cock pouches, both primary and redo pouches while I was there to see. Again, there was a lot of hand-assisted laparoscopic surgery, and particular to their practice, there was a lot of reoperative surgery. I think it would be fair to say that in the major centres, the quality of surgery is very high, but that they do see a lot of surgery from outside the major centres where patients have run into trouble, and it was very interesting to see their approach to these complicated patients. I was also able to see a little robotic surgery while I was there. They have 10 Da Vinci robots in the Cleveland Clinic, most of them sweeping the corridors, I think, in theatre. But I did manage to see a couple of robotic proctectomies while I was there, which was, again, interesting to see. So, in conclusion, I had a really memorable fellowship experience, and I'm very grateful to the association for getting me out of Glasgow for a little while and giving me the sponsorship to visit these units. And I'd also like to record my thanks to the staff and the teams, both at the Leahy Clinic and at the Cleveland Clinic, for their welcome and their generosity during my time there. Thank you.